Why have I quit my job? Why have I, bought a van? And why am I going to drive around the country? Well, I'm passionate about the idea that you need to be heard. And I want to stitch these stories together across the states. We're going to find the commonalities, and it's going to be really an amazing experience, and I look forward to you joining me on the jar. Good morning, everybody, and happy Memorial Day weekend, at least here in the U.S. And it's Friday before Memorial, so a lot of people's minds are already off work, and maybe even some people are already taking off work and on their way home. That was a little video and an audio of me kind of pontificating what life would be like traveling around the U.S. with a big jar of questions in that van and interviewing people in their homes and hearing their stories. So I did that for 2 years, and now I'm on a little bit of a break. And halfway through that, I started this podcast to better understand the mental health crisis that I saw up front and personal, as I went into people's homes and went around the country and heard stories, really of people overcoming, a lot of trauma, a lot of mental health challenges, mind health, and controlling your own mind, or learning how to control it, or getting off drugs or getting on drugs, and just some really interesting, beautiful stories. So I encourage you to find the Jar podcast and listen to some of those great stories. We've got another, this podcast, Mental Health Today, has been interesting for me because it allowed me a chance to understand the industry better. I began by interviewing people who were in the mental health space, trying to do their part to help address a crisis. And that's kind of evolved to where I felt I got a good bit of understanding of what the industry looks like. And now it's kind of talking to stories around the edges, if you will, people who are, have a story that they're in the middle of the story, or they're already they're at the end of the story, and they want to share again what happened and how we can kind of better improve on the whole mental health in America. And Laura's got a wild story. I mean, definitely an interesting backstory with her son, and she's in the middle of the battle. She's in the middle of the struggle. So Laura, when I'm just look forward to hearing some of this story, Laura, and how we can help. And thanks for being a guest. Thanks for taking time out to share your story.
Thanks for having an interest in spreading awareness and education on mental health. The moderate to mild population has been getting a lot of attention, but the serious mental ill population has not. And so I hope with this podcast, we can start gaining more interest, curiosity, and spread the word that the serious mental illness population needs a voice. And they are the most fragile in our society currently, in the homeless population, in jails, cemeteries, and hiding out, not seen at all by health professionals. They're just suffering alone, and their families are left with their hands behind their back tied, and they don't know what to do. So I'm hoping we come up with solutions together and spread the awareness of solutions that are currently being talked about for that problem.
Tell us a little bit. I mean, how did you end up becoming an advocate? How do you end up in this chair?
When you have a loved one who's going through it, it could happen to any walk of life, any professional. And in fact, a lot of the advocates I'm meeting now have been scientists, physical therapists, things that have nothing to do with the mental health industry, but they have like a doctorate in the serious mental illness population because of them dealing with it day in, day out. So anyone, it could happen at any time. So
tell us a little bit about your son, and where that's at right now.
My son is typical of the male younger population right now. He has a schizoaffective disorder that came on suddenly at age 20, but we'd seen hints of it earlier in high school, and then he was hospitalized once in his senior year. But the actual blossoming of it happened suddenly and rapidly at age 20. And before we could get a handle on it, he had caused a lot of chaos in his life.
Hmm.
Probably a lot of families like mine
Yeah.
have similar stories, but they're not speaking out for many various reasons because of the legal implications. When you involve the criminal justice system and mental illness, you don't want to make things worse by speaking out. But at this point, actually, my
Whoa.
son can't get worse.
What? I mean, that's a what? Like, whoa! What did you just say? It sounds like. I mean, it sounds like a really bad version of. I don't want to say what my politics are on Facebook because I'm afraid of the hell that I'll bring down on myself. So that we can't criticize the mental health industry or the regulations around it, and otherwise it'll bring worse situation for the patient.
No, I mean
Yeah,
situations like
I mean
you're
that.
out about what your son is doing and he's in trouble with the law. You'd be worried that lawyers would,
Ah, yeah.
and but at this point, he has 5 lawyers, and they're for 5 different courthouses, and he has been inside a courtroom 55 times in the past 19 months. So right
Whoa.
now, the system has tied itself into knots trying to figure out what to do with Nick. And because we don't have an AOT law in Massachusetts, the legal system and the medical system are not communicating.
Yes, right. So
So that
are they I mean, does a prison system want him? Because I mean, if he's really needs mental health, I would imagine they would want to pass him on.
it's like the hot potato. Nobody wants.
Yeah. Nobody
Uh,
wants him.
yeah, and that's
Ah.
not the mental health, not the hospitals, not the psychiatrists. I mean, people like my son get fired by reputable psychiatrists because of how difficult he is to treat.
Yeah.
Is a very smart individual who's afflicted with a brain disorder that makes him be able to speak well, but defend his own mental illness. In other words, he can talk
Wow.
very clearly about how he has no mental illness, and you would believe him. But then when you listen to the records of witnesses and professionals and family members and people in the community say what he has done or said, then you have a completely different picture. So that's where it's difficult. And a person like my son, which is typical of schizoaffective or bipolar 1 with psychosis, is the side effect of having no idea that you're ill. So you're too sick to know you're sick, and therefore you're not going to seek mental health treatment. You're going to have to be forced into it.
Yeah,
And
and then you're articulate as well.
yes, and that therefore even judge
Whoa.
lawyers and psychiatrists even sometimes are fooled into thinking that he's
Yeah.
okay, or until he mentions something that doesn't color right and you're aware it's still a problem. It's false fixed beliefs that stay, and they stay sometimes decades, and there's nothing you can do to pierce that unless you have medication in your system to alleviate and repair the brain damage of untreated psychosis, untreated
Okay.
psychosis.
How many people are there like Nick around in the world?
The statistics, I just came back from a conference at the Schizophrenia and Psychosis Action Alliance, where the Treatment Advocacy Center gave a lecture, and the numbers are astounding. So cycling in and out of prisons right now per year is 2 million with serious mental illness. And they should be in hospitals or in care in the community, being watched
Yeah.
or carefully by a team, but they aren't, unfortunately. And that's what I'm hoping we can address now, so that the prisons who have, I think it's upwards of 380,000 people currently with serious mental illness incarcerated, to a lesser number, because it's not
Wow.
fair to be punished for a no-fault brain illness. They are taking deinstitutionalization to a new facility instead of being in a hospital now,
Yeah.
prison. And
Yeah. Reagan, Ronald Reagan gets a lot of blame for this. I don't know enough of the history, but I've had a few people on or things that I've read, and that an act that he signed kind of privatized the hospitals or disbanded. I don't quite remember what that was. You must be familiar with that backstory.
Kennedy, it was who got rid of institutionalization in the 1960s. He was
Okay.
hoping,
Okay.
to prepare a place for that population. And fortunately, he was assassinated. The
Oh,
second step was never completed. And
yes.
so now the civil rights advocates who don't know enough about this population are speaking out against their involuntary hospitalizations as not being humane, but that is the actual opposite. There's nothing more carceral than being in the midst of psychosis and unable
I
to escape your own.
I agree with that.
Uh,
Yeah. I mean, there is nothing that is absolutely inhumane is to let people suffer, and especially when they're not even aware of their own disability. I guess a disability is what it is at that point.
and
Um,
a lot of similarities between the side effects of this illness, too many to ignore. They all have similar presentations where, for instance, my son uh, came home after being missing for 3 months, very thin. He had lost 20, 30 pounds. And when I brought him some fruit, he looked at me and he said, I don't need food to exist. And that has been
Uh-oh, that's a
uh,
bad sign.
right. When you believe you don't need food to live,
Yeah.
then you need to be forced. And believe it or not, I tried 14 times within a 3 month span to get him the medical treatment, quoting what he had been saying to me. And the doctors were saying, well, if he's not a threat to others, then or himself,
We can't do anything. Yeah.
be treated. And you can be crazy, but not forced medicine. And that's where I wondered, why is that? Well, I was shocked, that theory.
Yeah, you're finally at the right spot. You've got your son, and it's like, okay, here's the proof. Let's get him help. And the doctors went, no, it's a free country. You can be crazy.
And at one point at the beginning, I thought we were the only family going through this. And then once he finally was hospitalized the third time within a 17-month span, I started getting help for myself, with other parents and listening at NAMI group supports and support groups of the criminally insane hospital families. They all had the same story.
That's
Uh,
wild. There's actually a group of families of criminally insane hospitalized, like institutionalized in jail
yeah.
families.
So
Holy
when
bananas.
belonging to those groups and you're hearing their
Yeah.
story, they're all similar to yours. And there's
Yeah.
now upwards of 200 families just in your area alone. You wonder how come not everyone is learning about this.
Yeah.
Because, and then my theory was they're too tired. They're exhausted. They're traumatized.
Oh,
They're
yeah.
suffering. Of course, they're not
Yeah.
going to speak out and advocate. They're too broken by their loss. And
Eventually it breaks the families as well.
yeah, it's a ripple effect, and it is a generational effect. This will affect many generations of their families. We got
How
to
do
stop.
people find you? How do people find you or find resources? How do they help? Two things. One, how do they find help, or how do they help?
My
Or
biggest source of help was the National Shattering Silence Coalition. They are a little bit more proactive in getting you one-on-one advice and care about the crisis you're in. They go and work hand in hand with the law and help you work with the judges and the lawyers and help you work with getting your story in front of the right policymakers so they can
Mm,
be carefully crafting reforms in the state
okay.
and federal level. So NSSC, National Shattering Silence Coalition, that's my biggest group that's helped.
That's good. What's the situation at the federal level? What change has to happen there?
Well,
Assuming you get the states to kind of allow for involuntary, help.
IMD exclusion. Well, we're trying to get many changes made through our advocacy. The AOT, the Assisted Outpatient Treatment law, is an order that can be finessed. Right now, it's in 48 states, but it's not being run efficiently, and the wrong
Mm,
population is sometimes mistakenly gathered, and we don't want that either. We just need the ones who are not functioning in society, that are continually creating a
yeah,
situation where they can't survive on their own. Those are the ones who would need the AOT order, and without it, are going to be left to tragedy. And right now, even the states that have the AOT are not utilizing it. The hospitals aren't telling the patients about it. So, how would the families even know it exists? And it's because the AOT is not looked on favorably by the civil rights groups, and therefore they have a louder voice. And unfortunately, from the top down, are not spreading awareness or encouraging people to use it. It's a
yeah.
1 year service that has to be renewed every year, with a team between the courts and the psychiatrists and the nurses and the caseworkers to all come up with a plan, not just to restore stability, but also to go back into the community safely and be able to work and live and be living independently, if not even in just a group home. So once they're out of the hospital, that's where the problem begins. Because once we
Yeah.
got hospitalized, we thought, oh, well, he's rescued now. We tried 14 times. We did it. We got him. Well,
Okay.
a few weeks later, he's back out on the streets with a bottle of antipsychotics that he would never take. He threw away at the first opportunity, and there was no recourse. So then a second hospitalization happened 2 or 3 months later. And this time it was a 2 month hospitalization at McLean's, the best in the world. And in order for them to keep him there against his will, they had to have a trial. And we had 2 hours of testimony from psychiatrists and family to get the judge to understand that he needs this medicine. They gave it to him for 5 weeks and then let him go to a homeless shelter and said, come back in a month. And he never did. And there was no recourse. 10 months later, he attacks his father and almost kills him in a psychotic episode where he thought he was seeing and hearing the devil and seeing and hearing things that his father was doing that he wasn't. And he was now physically,
Yeah,
um,
physically violent now. Yeah.
yeah, that had never happened before. And that was, so that was 2 years of being untreated for this serious mental illness, brought him to a depraved state of mind that he was so frightened. And he explained to us later in the prison, he just thought he was fighting for his life. He thought his life was in danger.
Good God. How many people do
So,
you think are home? How much of the homeless population is in this state?
well, it's not just the homeless population, the homeless population that's addicted to drugs and alcohol. I, you can't really tell which one came first, but I'm mostly positive that their mental illness being untreated led to such a desperation that they needed to resort to alcohol or drugs or
Hmm.
were by
Yeah, they're self-medicating.
yeah, Nick is so young and he was so against any medicine. We were lucky he's also against any foreign substance. He did smoke marijuana because he thought it was natural and he felt safe having that since age 15 as something he used with his friends to self-medicate. But turns out when he got sectioned his second time, the emergency room doctor told us if he smokes marijuana again, he may have treatment-resistant bipolar. I didn't even know treatment-resistant bipolar could even happen, and that psychosis could be something brought out from marijuana to such a degree that you would have a psychotic spectrum disorder. The schizoaffective disorder is what it turned into because of so many episodes. So now he's very difficult to get well. And if it had happened earlier, that we were able to get the doctors to really keep him and get him on a regime, maybe they say around 18 months is what it takes to really pierce that veil of unknowing that you're ill. And as they call it anosognosia. It's a side effect that is brutal. And there's no way to get around it except antipsychotic medications for a specific amount of time. 1 week, not 2 weeks, not 5 weeks, not 2 months. It needs to be minimum 18 months. And I'm hearing now that the street psychiatrists recommend to the homeless population a 3-month injection so that at least they'll have some fighting chance to know maybe they need another shot. Things did go better, with
right.
3 to 6 months is what they're recommending. But to get him to agree to that shot would be near to impossible unless you had an involuntary injection. And that's, life-saving. And AOT is not about injecting against your will. It's about keeping up your treatment so that you're not left to fall through the cracks.
Right.
And create more problems. My son has so many criminal cases all piling up within a year, because of untreated psychosis. And now he faces 3 open court cases still, and they don't know what to do with him. Because, yeah.
And they're not, are these bailable offenses or not really?
He's considered a danger to society, unmedicated now because of the physical action that took place.
Pardon my laughing, but that, like, the irony here, like, this is how stupid the government is, right? Like, he's a danger to society. Yeah, we really want to medicate him. We know that. We've been telling you that. Yeah, you're not allowed to do that. We could let him out if we gave him, if we had a place for him for 18 months and we could actually make him at least aware of his illness. Yeah, we can't do that because he's a criminal.
And I think a lot of stigma, even side of politics and government, the Department of Mental Health in Massachusetts, when I begged them for help, they said, well, he's in the criminal justice system now. Sorry. And
he's a criminal. Yeah, he's not. Yeah. Yeah, he's not a mental health patient.
The hot potato.
Oh, my God.
And I think the department.
That's shocking.
More accountability for the serious mental illness population. Their policy is that you have to willingly come through their doors for treatment, which 60 to 90% of schizophrenia patients and have this inability to know they're ill. So that means 60 to 90% of the serious mental illness patients that need help aren't getting help. So that's there's so many things wrong.
It's hard to believe that anybody in a professional mental health person would think that that's a good idea.
I only can equate it to the fact that they're trying to handle the patients that are more handleable, like the moderate.
Yeah. Makes your numbers look better when you can treat people and they get better.
Right.
Maybe that's based on grants or based on more money. The best way to get more money is to have a high success rate. And then the best way to have a high success rate is keep the untreatable people away from you. Keep them off your numbers.
Right.
It's either that or incompetence or just stupidity.
I don't know. Honestly, they can't ignore it now because too many untreated mental illness patients are causing bizarre tragedies to happen. And,
yes.
our society is not as safe as it once was, and we need to have more attention so that everyone can go out of their doors knowing that the person next to you has a handle on his own brain.
Yeah. I mean, most of these every person shooting up schools and buildings and everything is an absolute mental health patient should have probably 100 times had an opportunity to be put into a place and taken and given the health care they need. And somehow every one of them you read about it, slip through the cracks, slip through the cracks, slip through the crack. Um,
And I know now why, because
and
I'm an intelligent, well-educated person trying my best to get the help for my son and come up with walls. The caretakers who are actually in the lives of the serious mental illness patients are not included in conversations. When you have someone with cancer, for instance, you bring the whole family in and talk about treatment, sit down, and you keep going and you come back. Oh, he's doing well, he's not doing well. What can we do to support him? That conversation never happens with the serious mental illness population because of HIPAA laws that are outdated and need to be changed. And so there's a
well,
lot.
there's no money in mental health. Quite cancer. There's a lot more money in cancer.
Well, the mental health numbers actually are quite high. I think there's something like 5 times the amount of money we spend on military currently in this country, even though we have a great mental health care system. The amount of money we're spending on the patients is alarming for a country that's not doing well with mental health. So that
Yeah.
could be a reason they're going in the wrong directions. They're throwing money at a problem. I mean, the amount of money they've spent on my son when they could have just at the outset had him properly treated is
Yeah,
astounding.
it's amazing the impact, the cost impact on one person, right? The time and resources had you guys been able to, as a family, do what he needed,
Yeah.
um, and now the after, and so you just multiply this times 100,000 nicks around the country.
And as an epidemic right now, I'm hearing about from the early detection psychosis centers. Like, for instance, there's one in Massachusetts called Empath. They're saying the emergency rooms are being filled now with cannabis induced psychosis. The younger kids that have had THC levels that were much higher in their marijuana smoking from age 15
Yeah.
on, like my son, are now experiencing bizarre fixed delusions, and some of them are command hallucinations that are telling them to, I mean, my son, for instance, gives things away and it's dangerous for him. It's a bizarre illness. They're doing things that you can't predict, and
Hmm.
you can't possibly get prepared for what they may do or say, and that's
Okay.
due to the cannabis. And we're not talking enough about that. There needs to be warning labels on the dispensary doors. There needs to be a billboard announcement. There needs to be commercials made. It's going to be like the new tobacco with lung cancer. There's too many people suffering with
Yeah.
schizophrenia and psychosis that would not have if they had not inhaled.
It's still a drug, and it's, a dangerous drug. You gotta be careful. What's next? What's on your horizon right now, the short term and maybe the long term? What are you working on? What's your plan? And
Trying to stay above water. We are going on our next month will be our 56th and 57th court hearing for Nick. Hopefully, with resolution, they've hired a psychiatrist for $2,500 from state money to take a look at Nick. He's already been analyzed at the Bridgewater State Hospital, which is our criminally insane hospital, and evaluated by a forensic evaluator and declared incompetent by them and not criminally responsible by them because
okay.
is irrational thinking. But yet the courts now need some education about it. So even with that document, we are still not getting anywhere. He's still in a prison cell, locked 20 hours a day, with 4 hours in the community that I actually worry what he may do in those 4 hours, even in the prison, in the maximum security prison. So,
Oof. Yeah, I mean, he's with other dangerous people, and not just him,
unmedicated, and he doesn't
all
have
unmedicated.
a psychiatrist or any type of medicine in him, and he's hearing and seeing things that aren't real. And hopefully, actually being alone is a place he prefers. He isolates because I think when you hear and see things that aren't what everybody hears and sees, you'd rather be alone. So anyway, I mean, it's just not ideal, but until he gets a hospitalization, he's not safe to be in society. We as a family hope that he will take the that the courts will take the route of stabilizing him with medications, and instead of putting him in a prison, just locked away and warehoused. So, I mean, there's a documentary actually called Warehoused, of a woman that's in our coalition, Tristan Murphy's mother. Tristan Murphy was a suicide by chainsaw that happened in Florida. While incarcerated, he was given work detail, and he just picked up the chainsaw and cut his own head off. So that's what happens when you're in a room alone and you hear these voices all the time with no help or no relief. You just want it to end. And so we just hope suicide is not something on our horizon. We are begging law officials to listen to us,
Yes.
needs help.
And so, I'm sorry, the next court date, you have a date yet?
June 24th and
So you
June
said
20th.
June 20.
So one is
Okay.
in Superior, one is in Cambridge District Court. These are for two different offenses, and both court houses are now talking to each other, but it took 2 years for them to pay attention, and they still don't have any idea of Nick's previous hospitalizations because Nick is not allowing them to see them.
Oh, and
They,
he can do that with his HIPAA records.
so I'm on. So
And so
anyway,
he can hide his HIPAA because of HIPAA. He can hide his medical.
yes, and the lawyers are, the judges are not able to subpoena all the medical facilities without good reason or probable cause.
Wow.
So nobody is talking to each other. The judges are different every single time. We've had 55 hearings, and I'm pretty sure we've had at least 40 different judges now. So how are we going to have one judge know,
Yeah.
this? It's
That's
just,
not gonna like, I mean, imagine being a new judge and you see this and you have no context. You're not gonna take the extreme, which is like release him from jail and put him in a mental fit. Like, you're not gonna do that unless you've seen him for the third, fourth time and you start realizing, okay, he's not the same guy. He's a different person every time. He needs help.
which is why we need assisted outpatient treatment. The judge goes and becomes the point person
Yes.
to make sure he's not just out of prison or out of jail, but he's in society and continuing to thrive and be safe. And
Yeah.
that needed this bill in Massachusetts for 15 years now. And so many people in Bridgewater State Hospital are in the group saying, well, my son or daughter wouldn't be there if there was an AOT. And
Yeah.
some of them are serving double life sentences for things that they now have been given medication for. So they're incarcerated in a mental hospital for the rest of their lives for something that could have been prevented had
Yeah.
there
Understand.
been law. So I don't know why people are still in a way. NAMI Massachusetts has taken a stance against it, even though NAMI Massachusetts affiliates are for it. And they haven't taken a poll or asked all the members of NAMI in Massachusetts what they think, but yet they've actually spoken out against it in Congress, in the state. So what I'm hoping with this podcast and with our words, that advocacy groups will take more time to really read the literature in the AOT bill and get to know it,
Hmm.
because without it, we are going to continue seeing lives lost, and they're just going to keep growing. And it's a shame. They'll realize it too late.
Yeah, that's great. If you can send me, maybe when later, drop me an email with some of the websites or the advocacy groups that we need that you want to take more action to get a little bit more aggressive.
Well, for Massachusetts, the aotnow.org website is the main group
The
that's
main one.
AOT in Massachusetts. But then we got to work on Connecticut, and then we got to go federal. But that right now needs the most help. If you can write to
Hmm.
Liza Williams at NAMI, Massachusetts, too. She needs to have more awareness and talks about assisted outpatient treatment. It needs to be supported in Massachusetts.
Okay. How do people? I mean, maybe any last thoughts, any kind of comments, any kind of a plea. I guess was a good chance to do a little bit of a reach out, a plea out, for any kind of help or support, and then maybe any kind of closing thoughts.
Well, I want more families to speak out. I don't want to be just the only one, because
Right.
you're out there and you're afraid to speak. So there's one plea.
Yeah.
I can reach National Shattering Silence Coalition to get their stories told confidentially,
Okay.
and that is nsscoalition.com. National Shattering Silence Coalition. We have support groups, we have peer talks, we have guests that can really. We have AOT judges that have retired and joined us to help unify AOT over this country.
Oh, I
And
love that.
yes, and so we have professionals, we have caregivers, we have peers, and we have families of loved ones, and we're all trying to make mental health reform. So I need everybody to support NSSC, National Shattering Silence Coalition.
Well, you get a nice comment, Laura, from Ann. Thanks
Yes.
for being a voice for every family like ours throughout Massachusetts.
My son's story is extreme, but there are many cases that aren't as obvious, and they need a voice. They need a champion.
Hmm.
We need a state house champion, and we need a media champion. We need awareness. That's what I'm calling out for help for.
Okay.
So I appreciate you, Ken, stepping up and doing this.
Yeah. I was, I was kind of really, I was touched by your story. And I mean, especially Nick. I mean, oof, poor
I'm
guy.
Yeah, when he's through with all this, he can advocate for himself like Eric Smith does. And that someday, when he snaps out of the psychosis and the false fix beliefs, that he'll look back and thank us for fighting this hard.
It'd be amazing to see him on a stage
Yeah.
talking about it.
Yep. He has a very large personality. He's charismatic. He's influential.
Yeah.
Fortunately,
Yeah.
that's
I mean, obviously he's pretty good. He's pretty good at fighting. I mean, how many people can actually be clever enough to be criminally insane, but also keep the judge out of my medical records. And also, I'm sure convince a lot of people of a lot of stuff. I bet he's got stories you don't even know from the
tells me
streets. And
little, and I'm the only one that knows them. So I have now a treasure trove. I'm keeping track.
well, I hope for nothing more, Laura, nothing less than to see Nick giving a presentation sometime on a stage and sharing his story as an advocate, and that would be a beautiful miracle.
Me too. Let us get to that day.
Yeah, yeah, that's a great little kind of vision to have for him. But definitely going to come with with mom's help. Not
Yeah,
happening. Not happening without a mom.
just
Power
like
of
the
mothers.
moms, there's so many groups out there that are made with women, especially because they're facing the problems and getting it done. I mean, not to bash on men, but women, especially mothers, they lift up the cars when there's a baby underneath. It's like they pull it together.
So true. So true. Laura, thanks so much for sharing Nick's story and being an advocate for people,
Thank you, Ken.
especially as your friend said. Um, hang on for 30 seconds, and I'll see you on the other side.
Will do.
Thanks everybody for supporting mental health today. This is kind of a sleeper project for me. Yeah, I didn't realize I'd be so impacted by something I knew so little about. And so here we are. Thanks for being part of the journey. If you like the show, drop down, give us some stars, give us some comments. And especially if we did say something that really upset you, yeah, drop that down. Even write us a love note. I read everything. Laura, thanks again so much. And hang on, I'll see you in 20 seconds.
Yeah, loose, baby.
We're about to go and make this vessel with these great professionals at Public Glass. We're not part of the community, but we're from the outer family of glass blowing. Yeah, we're going to go make a magical giant jar with optic lenses so that if you turn it, it changes all the time. So if you change the way you look at things, the things you look at change.